As Dr. Miller-Meeks for her 5 minutes.
Thank you so much, Mr. Chair. I thank the members of this committee for the hearing, and I thank all of our witnesses who are here today. And let me just say, given some of the testimony I've heard today from my colleagues, that I'm a former director of the Iowa Department of Public Health, have managed programs that take care of addiction, a former state senator, and as a member of Congress have participated in both health care and bills that have been schools as a site of service for behavioral health, no pre-authorization for medicated assisted treatment, addiction programs to help addiction. And for those who cannot see or connect the dots between the border and the fentanyl crisis, I find that perhaps minds are closed to what is obvious to the rest of us. Ms. Garza, Representative Vesey, I think, contradicted your testimony in the reasons you said people are coming across the border. And he very aptly said that people are coming across the border unauthorized, without documents, for economic reasons. When I have visited the Border Patrol, and I grew up in Texas, went to San Antonio College, University of Texas for medical school, nursing school here as well, have never seen immigration, illegal immigration, at the level we have here now or to the level that you see with drugs coming across the border. People are coming here for economic reasons. We also have a legal immigration system where 1 million people are supposed to be coming across. Is it humane that people that are here waiting in line for decades are not able to come because we are processing through 4.5 million illegal immigrants in 2 years? Is that humane to those individuals waiting? It's a yes or no answer.
I would say that the solutions to these problems are more complex
yes or no?
than your talking points.
Yes or no?
It is a complex
Thank you for your answer.
Issue.
Do you know how many deaths there were crossing the border in 2020? How many deaths of illegal immigrants crossing the border in 2020? Do you know the answer to that? 347. In 2021, 546. In 2022, 853. Is it humane for a government to have pull factors to bring people across the border on a perilous journey, as you have described, with a death rate of that? When, March 5th of 2019, the New York Times claimed that the border was at its breaking point as more than 76,000 unauthorized migrants crossed in more than a month in February of 2019. It was at a breaking point under a different administration, so perhaps there is politics involved. Are you aware of how much money the cartels make in smuggling people across the border? $13.5 billion. Does that help to ameliorate any of the poverty or economic disadvantage or lack of health care in any of these countries? No, it does not. Are you aware that $51.6 billion in remittances went back from illegal immigrants, migrants in the United States to Mexico? And does that have anything to do with why we cannot control our southern border? Fentanyl and fentanyl analogs have been responsible in 2019 for 28,000 deaths, in 2020 for 28,000 deaths from flu, 38,000 deaths from auto accidents. For fentanyl, the overdose deaths in 2020 was 91,799, 2021, 106,000, and this year, which is not yet available because we're a year behind. We consider flu at 28,000 deaths a year to be endemic. I would say that this would classify as an epidemic, our fentanyl opioid crisis. The Council on Foreign Relations called it that, the CDC has called it an epidemic, and the Washington Post in December of 2022 has called it an epidemic. Mr. Judge, you mentioned, and I just want us to underscore this point again because there seems to be people who don't understand the connection between fentanyl coming across our border. Again, are illegal drugs coming across the border and are illegal immigrants being used as a decoy to allow drugs to come through places other than ports of entry?
Every single day.
Thank you. Now that we've had the CDC, the Washington Post, the Council on Foreign Relations call the opioid crisis, the opioid and fentanyl epidemic, an epidemic, Mr. Archer, currently Title 42 authorizes the HHS Secretary to restrict persons and importations from foreign countries to prevent the introduction and spread of communicable diseases. The purpose of this authority is to protect the public health from serious danger. As has clearly been discussed, and as I've just alluded, by non-right-wing publications who have considered the fentanyl crisis as an epidemic. As established today, fentanyl analogs are a clear and present serious danger to the public health of our communities and constituents. Would updating Title 42 to include certain substances, such as fentanyl and fentanyl analogs, and specific opioids and narcotics, be helpful to you and agencies, companies, and communities that you serve?
Yes.
Thank you very much.